everyone, welcome to another episode of Simply Heal, and today we have our regular guest from Simply Consult, Dr. Jansen.
Hi Chan, glad to be here again. Hello everyone.
Yeah, so by popular demand, we are back with our monthly COVID-19 updates. So Doc, I heard from you that the good news is that you're seeing less and less COVID patients at your clinic.
Yeah, absolutely. The past week I've seen zero COVID patients.
Alright, so that's good news, and we are now in the season, at least here in the Philippines, and also in Singapore, booster shots.
Yeah.
Booster shots are the hot topic right now, because if you don't know it, let me remind you, for those of us who were vaccinated last year, our vaccination is already waning, right? So the thing now is that there might be a need for booster shots. So today, Doc, you're gonna go through with us the guidelines that were just released on booster shots, right? So Doc is gonna go through that and also the international one.
Yeah. So to begin, first, why do we need a booster shot? Okay, what's the principle behind a booster shot? Okay, so in vaccinations, the reason why we give booster shots is to let your immune system mount another reaction. Okay, mount another immune reaction to the virus. Okay, so it's sort of like retraining your immune system. Okay, so that when the time comes that your body encounters the virus or the COVID-19 virus, your body will be able to fight it off easily and you won't get sick. Okay, so that's the principle behind booster shots. Now, booster shots have been done for many years already. Okay, it's an established concept. Even kids, when our kids, when they go for the vaccination, their HEPA vaccination, their polio vaccination, these booster shots are needed. Okay?
But Doc, I have a simple question.
Yeah.
For tuberculosis, we don't have annual booster shots. How come the vaccines or the mounted immune response lasts so long for certain diseases?
Yeah. Okay, we have a vaccine for tuberculosis, BCG.
Yeah, BCG.
BCG.
I took it when I was in 6th grade, I think, or 3rd grade, something like
here
that.
In the Philippines, we vaccinate all newborns.
All newborns, okay.
BCG, yeah.
All right.
Okay, so these vaccines, the reason why they're lifetime.
Yes.
Okay, it's because these vaccines have already been developed for a very long period of time. So the trial and errors, it's sort of like it has been perfected already.
Oh, it's like a perfected vaccine.
Yeah, it's a perfected vaccine. So as you all know, the way vaccines are developed, it takes decades. Okay, so a lot of clinical trials, a lot of trial and error, a lot of investigations before they release it. But here in this pandemic, it's a special case. So a lot of things were rushed. So that's why a lot of clinical trials are still ongoing. The science is evolving. That's why, the things that we hear regarding the vaccines, regarding COVID, are changing really fast. Okay.
So that's why we are committed to doing this monthly update.
Yes.
So that because the science and the release of news from the pharmaceutical companies and governments and experts, they are always being updated.
Yeah.
I think we go with the right mindset. It's not that nobody lied. It's just that we have better understanding as time goes by.
Yes.
So do stay subscribe to us. Do stay in tune so that you get up to date. And most important, every time we do a Simply Heal session like this, we get a live Q&A, and you can ask live questions with Dr. Jansen. So right now, if you have any questions, you can start typing it up there, because we can see it on our screen, and our minds are gonna start tackling your questions even before we get to them.
Okay, so let's get to it. So here is the local guidelines that the DOH just released. So these are the recommended booster dose combinations depending on what you got as your primary vaccination. So we have 6 here: Sinovac, AstraZeneca, Pfizer, Moderna, Gamaleya, Sputnik, and Johnson & Johnson or Jansen.
Oh, we have Sputnik here in Philippines?
Yeah, we have.
Oh, okay. The Russian one.
Yeah, the Russian. Okay, so if your primary vaccine is Sinovac, Astra, Pfizer, Moderna, or Sputnik, then you have to have at least 6 months of interval before you get your booster.
That's
Okay?
yours.
So,
I just saw the Jansen
Yeah.
vaccine. That's Dr. Jansen's vaccine.
yeah, kidding aside. Okay, so at least 6 months from your second dose. Okay, so Sinovac has 2 doses, Astra, Pfizer, Moderna, and Sputnik are 2-dose vaccine series. Okay, so before you get your booster, 6 months should have passed. Okay, at least 6 months.
So
Okay?
you shouldn't get it if it's less
Before,
than 6.
yeah, because if you get it before 6 months, then there's not really any significant benefit because your antibodies, your titers are still high. Okay, the immune response from the primary dose series are still strong.
Doc, I mean, sorry, just to interrupt again. At this point, because you did mention that vaccines usually take like decades to develop, and right now the current vaccines that we're doing, the safety record is there, but since so it is still a learning process, right? So would it be correct? I mean, I think I'm voicing the concern of some of our viewers. Would it be correct to say we wouldn't want to be too trigger happy and take more booster shots than are totally necessary?
Yes, absolutely. Because taking more than what is necessary will, number one, the benefit, the risk benefit ratio, it's tipped off. You get more risk out of the benefit, okay? Because
we're still learning about the vaccines.
yeah, we're still learning about the vaccines. And number two, if the interval is too close, you get more than what you need. The benefit will not be really significant. Well, the risk, you still have the risk, right?
You still have the risk.
You get a lot of the side effects, and these side effects are already known.
Yeah.
Okay, so after 6 months, no, so you have 2 choices. Okay, you can get the homologous booster or the heterologous booster.
Oh, what's
so
that?
What's that? Okay,
Yeah,
homologous,
big words.
big words, right? Homologous is just another term for same.
Okay, either get the same brand of
Same
vaccine
brand, yeah.
or a different.
Or a different one. So that's homologous and heterologous. Okay, so if you got Sinovac as your primary vaccine, then your booster, you can get another dose of Sinovac as your booster, or you can opt for either Astra, Pfizer, or Moderna as your as your booster. Okay, so if you are vaccinated with AstraZeneca, like me, so I can get Astra
Pfizer.
again for my next dose, or Pfizer or Moderna. Okay, either of those. And then if you got Pfizer, it would be either Pfizer again or Moderna and Astra, or Moderna or Astra.
So that's all the
some other
combinations.
brands,
Doc,
those are the combinations.
I
yes.
noticed on the screen right now that for the heterologous booster, which means different brand, right?
Yeah.
Sinovac is not paired up with any of the other ones. Is it because, I mean, in Singapore, we took a long time to clear Sinovac, even though Sinovac is being used. And for Singapore, the reason was that our FDA were requiring certain disclosures, which they were not able to get the data set from Sinovac. That's not to say Sinovac is not effective. Right now, Sinovac is being used in Singapore for patients who are allergic to mRNA vaccines.
Yeah.
But is there a reason why here I see in Philippines the combination?
Yeah.
If you took AstraZeneca, Pfizer, Moderna, they don't recommend Sinovac as your
Okay. Here's an educated guess.
educated guess.
I don't really know the reason why they did not include, they did not consider Sinovac as a heterologous booster. But I am thinking that it's because Sinovac's vaccine efficacy is lower than the other brands. But even if it's lower, the vaccine efficacy, when it's still effective in
Stimulating your
the
immune response.
Yes. So there you have it. And then next we're going to the Johnson & Johnson, so J&J. If you received a dose of Johnson & Johnson or Janssen vaccine as your primary vaccination, then you have to wait at least 3 months before you get another. But hold on to your horses, okay? Because it's not yet for implementation. We have to wait for DOH to give the go signal, okay? But if you are really keen on getting your booster shot already, then you can opt for the other brands like Astra, Pfizer, or Moderna, right? And all booster shots are only one dose, right? One dose. Okay?
One dose, okay?
Yeah.
Don't go for more than one.
That is for the Philippine guidelines, for our local guidelines, no?
What about the international?
Yeah. So here's the thing. In the US, this is the CDC guidelines for the booster shots, no? So in the US, they primarily use Pfizer, Moderna, and Johnson & Johnson. So if you've received Pfizer or Moderna, and if you are already 65 years old and up, in a long-term care setting, you have comorbidities or some underlying medical conditions like cancer, diabetes, hypertension, your weight is through the roof, or you live in a high-risk setting, hospitals, healthcare facilities, construction setting. Okay, so you have to wait for at least 6 months before you get your second dose or your booster dose. Okay, so it's the same, right? But here's the thing: in the US, if you've received Johnson & Johnson, and then if you're already eligible, then when do you get your booster? So it's at least 2 months after your first shot. Okay, at least 2 months.
So in the US, they are actually using the Johnson & Johnson for booster shots, but here in the Philippines, not approved for booster shot yet.
Not yet, but well, we always look to the US, so it would probably be the same. Okay, so 3 months, okay, for Johnson & Johnson.
There you have it. We kept it short and simple because we know there'll be lots of Q&A, all right? But before we go there, Doc, there are segments of our viewers who are maybe very cautious about vaccines, maybe because they have allergies, they have sensitivity to drugs, or they... So here's the thing, Doc, if they want to minimize or they want to know how well is their antibodies, is there a way to check whether my immune system is still strong and I don't need a booster shot yet? Is there a way?
There's a way. So remember, during the start of the pandemic, right? So we are basically using antibodies as an indirect test to know if an individual was exposed or not. So those tests will be very useful to know if you still have antibodies. So for example, we have a test called ECLIA test, ECLIA. So it's a quantitative test to check SARS-CoV-2 antibodies in your system. All right. So those of you who have been exposed, who got sick with COVID, those of you who have who were vaccinated with COVID-19 vaccines, then your antibodies should be elevated, should be high. Okay, at least it's way above normal. All right, way above the reference values. Okay, so ECLIA test is a better test to use. But if you just want to know if you still have antibodies or not, then the rapid antibody test kits would suffice. But,
that would just be a positive, negative.
Yeah, it would just be a positive, negative. But again, those antibody test kits are not really accurate.
That's why they can't give you an exact count.
Yeah. It's better for a quantitative count.
Doc, I ask you this because I know a family member of in my family in Singapore, the aged parents, right, mom and dad, right. So it's time for their booster shot, but they also wanted to make sure, like what we said, we don't take shots unnecessarily because we are still in the learning stage of all the vaccines. They are safe, but we want to take what is needed only. So what happened was that my relatives went to take an antibody test, and it came out that the lady had more than the count was more than 2,000. So I don't know whether that means anything to you.
That's really, really high.
Oh, really, really high. Okay. The guy who is her husband was 800.
Yeah.
Okay. So it turned out that after they did the test, they decided that the guy would have to go for the booster shot immediately, and the lady would wait until her turn comes. So she's in no rush to go and queue and ballot for the booster shot. So is that what the the test that you mentioned just now? Is that what it will do for them?
Yeah, that's one role that it can play.
So we will actually get a number like 1,000,
Yeah,
500.
you'll get a number, 500, 1,000. But the reference value, if I remember correctly, the reference value, I think it's 10. Yeah, I think it's 8 or 10, the reference value. So if if the result is more than that value, then that is
so you have a
you
very
still
strong
have,
immune
antibodies.
system.
Yes, you still have antibodies. So
Doc, is it possible for a person without vaccines, who has not been vaccinated, okay, but can they go for this test to see if they have antibodies for COVID?
yeah, absolutely. If they were, especially when they were exposed to COVID, then definitely they would have antibodies.
And because some of us might not have been vaccinated and didn't fall sick, but we might have been
We just
asymptomatic and we didn't know, and the truth is, the moment you've been infected with COVID before and you've recovered, your antibodies are up there, you're strong. You shouldn't get COVID-19 like the next day again, or even the next week. You are as strong as a vaccinated person.
Yeah, correct.
So an unvaccinated but recovered COVID patient, his immune system is as prepped up as a vaccinated
Yes,
one.
that's also the reason why we allow 14 days after you've recovered before you receive the vaccine.
All right, so I hope that's all useful to you. And last thing that I wanted to ask Doc Jansen is this. Doc, now that countries like Singapore are 85% vaccinated, right? So we've reached the crazy number already, and but yet we see vaccinated people being infected and end up being in ICU also.
Yep.
So can you explain to us how come the vaccination protection from the vaccination is different from different people?
Yeah, okay. So all of us have our own individualities, no? Especially our bodies, each of us react differently to the vaccines. Okay, so some people, we're not going to, we're going to tell you the truth. Yeah, even if you receive a full dose series, there's still that chance that you get severe COVID and die from COVID. Okay?
Even if you're vaccinated.
Yeah,
and that is true. In Singapore, a few weeks ago, there were 9 deaths, and 7 of them were actually vaccinated patients.
Okay, so what are the profile of these people? Elderly. Elderly people who have a lot of underlying medical conditions. Okay, so if you are, let's say for example, if you're 65 years old and you have diabetes, hypertension, your weight is way above, you develop cancer, you are taking a lot of medications as well. So yeah, your profile is in that category. Okay, so it's also very important not to be reductionist or not to be myopic about this. Doesn't necessarily mean if you are that guy, okay, if you are that person who have a lot of illnesses, your age is really senior already. So you have to be careful. You have to live healthily, okay? Because vaccines alone will not be enough for you, okay? So how do we go about this?
Yeah.
Watch our previous videos.
Watch our last update on the COVID-19.
Okay, we've discussed everything there on how you can reduce your risk. And another thing is, changing your lifestyle is really very difficult, especially if you love your lechon. Okay?
That's me.
Especially Christmas is coming, holidays.
Ham.
Your lechon and whatever, right? So we also have SimplyNaturePPARs, which can help you. Okay, so it's not 100%, but at least some of your comorbidities might be reduced. Okay, but these protocols are actually tailor fit to your case. So go for a consultation so we can help you out.
All right. Okay. So again, Christmas is coming. Go for a consult, especially if you're worried, right? Especially if you're worried, so that you can make sure that you're well protected. And for me, last thing I want to remind everyone is that it's not your vaccine that protects you. You get vaccinated to train your immune system to protect you.
Yes,
right?
Absolutely.
So we are all supposed to get vaccinated because no one would send untrained soldiers to war. So that's why it's so important for every soldier, before they are sent to the battlefield, they get trained. So this is why we are all encouraged to get vaccinated, so that our immune system is trained. However, it does mean one thing: if your soldiers are weak, then there's only so much the training can do. So you got to make sure your immune system is also prepped up. And that's where Simply Nature PPARs and a lifestyle change really comes in to help. And again, as Doc Jansen said, you can look at our previous videos that explains why not vitamin C, why not vitamin D, all that. You really need anti-inflammatory components and action to keep you safe, so that even if you get infected with COVID-19, it will just be mild and it won't reach the critical and ICU stages. Right? Any last advice before we go into Q&A?
Okay, Christmas is coming, so be careful, everyone. Our protocols here in the Philippines are becoming more and more lenient. We still do not know if there will be a surge after the holidays, right? So be careful, okay? But enjoy Christmas, everyone.
Yeah, enjoy Christmas. Take your PPARs, then you enjoy Christmas. All right, let's go to our Q&A.